26th, which means we are almost approaching I believe it's the 5-month mark of doing these each and every Wednesday with an occasional Thursday thrown in. So thanks for being here. As always, we'll have a few short opening remarks, and then we will open up the floor to reporters. And please indicate in the chat box to whom you'd like to address your question and the general topic about which you'd like to speak. And we will start off, as always, with County Executive Marc Elrich.
So, good afternoon, everybody. Let's go over a few brief points today. Our cases that were reported this morning are 47. That works out to about 4.1 cases per 100,000 people. Our 7-day positivity is at 2.4%. Today's positivity is about 2.7%. And the state's positivity average is 3.4%. On the testing front, we have made a really significant turnaround in our testing program. I guess it was a little over a week ago, we had to close things down because of the issues with the state and Advogenics. We have managed to revive our testing program. We're now doing several hundred tests a day, and we're continuing to ramp that up and open new testing sites in the county. Beginning next week, clinics will be scheduled every day, including 2 mobile trailers on loan from the CDC stationed. One is stationed on Randolph Road in the Wheaton area, and the other is at Lake Forest Mall. And Dr. Gales can elaborate on that if you'd like. This is actually back to school time. And if I were a school teacher, I'd be getting my room ready about now. But life is a little bit different. So we know that we're going to have virtual schools in the public schools. Some private schools, non-public schools, are back in session, and Montgomery County students will begin online learning on Monday. We still have not received any guidance from the state regarding non-public schools. No guidance, zero. So weeks after they told us that we should follow their guidance in the CDC, they still don't provide guidance. Hopefully this is coming sooner than later, hopefully before everybody gets back into school, and hopefully giving us enough time to evaluate plans that people may have so we can be sure that they are meeting state and CDC guidelines. We continue to feel strongly that it's not safe for schools to open, and we continue to recommend that non-public schools, which haven't made the decision not to open yet. And just like we do with other businesses, we will report citations and closures, which is consistent with what we've done for all other businesses. So if we wind up citing schools and if we wind up closing schools, that'll be reported like everything else. It's important to remember for the non-public school leadership, it is a law that schools that have positive cases should contact the county's contact tracing team at 240-777-1755. And I want to emphasize, it is the law that they have to contact the tracing team if they have any positive cases. On the election front, another thing that's been affected by COVID, our Board of Elections is encouraging voters to start a vote plan for upcoming election. Registering to vote, you need to get that done by October 13th. And then hopefully getting your ballot mailed to you. And we're emphasizing we want people to request mail-in ballots. They can either be mailed in or they can be dropped off. But mail-in ballots will get counted. They're on the same form as the regular ballot is. If you do an electronic ballot, then it has to be hand transcribed to another ballot. And those votes are very unlikely to get counted on election day and may take days and days to get counted, depending how many of those ballots there are. So it's really important to get your request in for a mail ballot and to fill out your mail ballot, either get it back in or be ready to drop it by when you get a chance. And I will stop there for now.
Dr. Gales.
Good afternoon. Always good to be with you all, and hope you and your families are continuing to stay safe. I'll make my remarks brief and to save time for questions. A couple of points to highlight. As the county executive mentioned, we have seen our numbers improve in terms of total cases, new cases, and our test positivity is holding fairly stable at 2.4%. One thing I do want to caution, though, is again, as we always talk about, looking at data points in the larger picture to get context of those particular stories. So there are a couple of things that we are paying very close attention to. One is the test volume. So what we have noticed again over the last week is there have been multiple days where the test resulted have been much lower than what we were averaging over the last month. For example, we have been pushing to and experiencing many, many days where we were seeing 25 to 30,000 tests resulted on a daily basis in the state. Today, for example, we saw 12,377 results, and that 440 cases that he mentioned is out of that 12,000 pool. Similarly, yesterday we saw just shy of 13,000 cases, and there were multiple days last week that were in the 15 to 18,000 range. So we're continuing to pay close attention to that to see if we notice any downward trends and the number of overall testing patterns that we see across the state, not just within our jurisdiction. As the county executive mentioned, this is back to school time. There's a holiday coming up, and it's important that we see our testing numbers continue to increase as opposed to decrease at this time, because it's important as we see more contacts and more points of contact between people that we have a robust, strong, sustained testing platform. Now, as he also mentioned, we will be going live with more test sites as we move forward. For example, our Silver Spring test site will go live tomorrow, and we will continue that on Mondays and Thursdays for basically from here through at least through the month of September into early October, and picking back up again after election season. So we're increasing our testing platform back to where we were pre a couple of weeks ago, and we hope to be able to resume the pop-up tests that we had put into practice in the next week or so as we work out some of those logistics around registration interfaces, and again, making sure that we have a robust system in place to make sure that our residents get their results in a timely manner, because timely notification of results is vital to our ability to effectively use contact tracing tools. One of the other measures that we also continue to look at is the percentage of new cases that are impacting our young people. As the county executive mentioned, in terms of schools reopening, it's important to make sure that we have a good understanding of, or at least some type of approximate measure of the prevalence and incidence within that age group, particularly as we hopefully are getting more young people tested and having a better sense of how they transmit it from person to person and what percentage of kids are showing up at schools or showing up in our community testing positive. I will also emphasize is that as we move forward, we continue to wait for guidelines from the state as promised related to non-public schools and schools reopening. In addition to that, while we wait for that, we have actually, going back to a promise we made when we first met with non-public schools, is we will be having our second, not our first, but our second town hall session with schools on Friday to walk through some of the nuts and bolts of Public Health 101. So for example, on Friday, we're going to talk about and emphasize the steps around contact tracing, what's involved in an investigation, and the different, as the county executive mentioned, the different rules and regulations that input requirements upon schools and businesses to report information to the health department to assist us in that contact tracing investigation process. So those are some of the things that are going on in our local jurisdiction. As you are well aware, we continue to see some increases in cases in other parts of the country. There are up-to-date guidelines and changes to guidelines on a daily basis, and we continue to pivot and respond nimbly to those as quickly as we can to translate it into policies and practices to keep our residents in Montgomery County safe. I will stop there, but as always, happy to answer any questions that you all may have.
Thank you, Dr. Gales. And Montgomery County did just update phase 2 of its guidelines, and part of that update was to upgrade the sport of soccer And to speak about that is Dr. Earl Stoddard. He is our Director of the Office of Emergency Management and Homeland Security and responsible for both response and recovery for this pandemic. Dr. Stoddard.
Thank you. Thank you for joining us again. I do want to talk briefly about one of the changes that Ms. Parker alluded to with regard to soccer. So to be clear, when we looked at soccer, there is still a national disagreement about where soccer should be placed. Ultimately, whether it qualifies as either a high risk or a medium risk sport, we have moved it to the medium risk category, consistent with the rest of the state of Maryland. However, there are some important things that we want to make clear about this allowance for soccer to proceed. First off, all sports are still governed by the requirement for wearing face coverings as laid out underneath the executive order. There are a few exceptions that are listed underneath the executive order for face coverings as it relates to sporting, and those are essentially where wearing a face covering presents a serious risk to someone's health, a bona fide risk to someone's health. And those are, few and far between in terms of allowances, medical allowances for the use of not wearing face coverings. But otherwise, face coverings are required while sports are being played. They're required on the sidelines. They're required by those spectating as well. As it relates to spectators, sports cannot have spectators except for the parents or guardians of minor children, as sort of laid out in the governor's executive order. They are not permitted to have other spectators outside of the guardians or immediate family of the person who's playing, and those in the case of the minor children. As it relates to both to any outdoor sporting activity, soccer included, they are governed by the outdoor gathering limitations, which are 50 persons, and that is inclusive of the participants, the coaching staff, and the fans, and those have to be regulated as well. And so I do know that there are, commonly within soccer, there are multiple games going on within the same fielding space. In order for those to be permitted under the gathering limitations, they have to be physically separated from one another in such a way that you cannot have intermingling of those groups of 50. And so we are happy to work with organizations that are attempting to hold those games and exactly how those can proceed. Overall, I think that sort of covers where we're at. The one last thing I do want to note is no traveling games with the exception of the state of Maryland, Virginia, and the district. So anyone outside of those three areas who cannot come in to play a sport. There have been some inquiries as it relates to certain, particularly the professional sporting and other things like that. And we'll work with, we do have a process to get approval for things that go beyond that. However, that process is handled on a case-by-case basis. There is a portal on our reopening website that allows for those letters of approval to be submitted. We do basically look for offsets in safety measures for organizations that are trying to get an exception for travel or for the participant numbers. And it's not just simply you ask and we give. It is we're looking for how you can make your event more safe that would allow us to consider those kinds of approvals. So I'll stop there.
All right. Thank you, Dr. Stoddard. We have 5 reporter questions in the queue. We'll start with Chris Gordon from Channel 4, who has a question for all 3 of our speakers today. Go ahead, Chris.
Right. Okay, if you can hear me, first of all, I appreciate it being called upon. On your executive order, you've allowed soccer games. We've just discussed this, but I'm told that you discussed but decided not to allow the ban on bars serving alcohol after 10 p.m. to be expanded, or entertainment at bars, not concerts, but a guitarist or comedian or something. So the question is that something you are considering? But also when it comes to closing, did I hear that you say that non-public schools, if they either have some kind of violations, Montgomery County could close non-public schools?
Who wants to start?
So I'll start. Closure is a decision of the health officer, and would not be closure of non-public schools would be a closure, if it's ordered, of a non-public school, not non-public schools in general. As far as the restaurants go, I mean, I continue to talk with people. I think our folks feel that without the drinking after 10 o'clock, that the behavior is different in the bars, and we're greatly concerned about the norms that we tried to establish breaking down after 10 o'clock. I've had conversations with the chamber. I'm going to have more conversations with them about the kind of things people would actually have to agree to, and agree that if they violate them, that the fines would actually be serious and the closures would be serious, because there's no point in loosening this up if people think they're just going to get a slap on the wrist, and that's the cost, just the cost of doing business. So I'm willing to talk with people. We're going to continue to talk. But, you know, there was enough evidence from contact tracing to highlight these kind of activities as potentially, you know, some of the greater risk situations that people are in. And we're determined to minimize the risk, the at-risk situations that people find themselves in. And your first question, the first part of your question was, I was working backwards there.
Yeah, first part of my question was closing, banning alcohol sales 10 p.m. and no entertainment.
And the entertainment. So the entertainment is still in the governor's order. And I have written the governor, I've written his staff, I've asked them to either clarify, you know, what this means, or to allow some entertainment as long as you follow appropriate protocols for protecting the patrons. I mean, I'll be frank. I mean, I've raised this issue with the governor's staff since they first made a decision to allow unlimited gatherings, but then said you couldn't have a gathering if you had a band. And I'll be honest, it didn't make any sense to say that you could, you know, put 500 people on a field, but if a band showed up, they had to go home. I think there are some common sense we can do or follow. I don't think, you know, if somebody is telling jokes at the front of the room, or somebody's singing or playing an instrument, as long as people aren't getting up, walking around, dancing, socializing, you know, aggregating in front of the stage, you can probably manage this. But we need the state to give us guidance on this. And I've asked for it.
Okay.
Chris? Can I just ask if Dr. Gales or Dr. Stoddard will talk about closing non-public schools? What, if any, conditions would have to exist, and could Montgomery County, or would Montgomery County close non-public schools once they open?
So a non-public school would be considered to be closed if it's deemed not safe to inhabit, and it would be looked at as any other, the same criteria, any other building, if there were unsafe practices happening. So consistent with the guidelines that we've used, particularly related to COVID, are things such as, you know, lack of adherence to the public health guidance that has been, and by law, in terms of, you know, face coverings, physical distancing. Certainly, if we were to have evidence of cases pop up in particular areas, as part of the investigation, if there were any types of practices that were in place that were deemed to be unsafe and rendered the space to be unsafe to occupy and to execute the role of teaching and in-person learning. And so if any of those types of criteria, consistent again with our process of investigating other businesses for their ability to comply with the local and the state guidelines related to public health practices, if there were instances where those types of policies were not being adhered to and were being violated, yes, the schools would be at risk of citation, fining, and closure.
The only thing I will add for your reference is that even in the amended when the amended executive order was sent to us by the governor's office, they did reiterate that the local health officers retain the authority to close individual locations. And as Dr. Gale said, that applies to any sort of businesses based on unsafe conditions. And that power is enumerated in the governor's order from April 5th, number 20-04-05-02. And that citation is what the governor's office referenced in allowing, including non-public schools, any business to be closed on an individual basis.
Did you say that by heart? Did you remember that by heart?
No, I've got a screen up in the background. I was looking up the reference to make sure I was correct, but
We were
yeah.
worried. Okay, good. Rebecca Tan with the Washington Post has 2 questions for Dr. Gales.
Thank you. 2 questions, one on racial equity and the other on nursing homes. The first one, Dr. Gales, I'm wondering if you can give us all an update on the racial disparities that we've seen in Montgomery County to do with COVID-19 infections, and whether you can say specifically what was the racial breakdown of cases that we saw in July.
Sure. So I will have to, I don't have it in front of me, but we can provide that information. I believe we did update it on our website in terms of the breakdown in numbers. We did see the percentage of new cases, for example, in the Latino community drop from 74%, I think it was 40% in July. So there were significant improvements in terms of the percentage of new cases across racial and ethnic categories. And it's important to note that in the context of the entire picture, we saw improvements in the number of people tested in each group. So we saw increases in testing across racial and ethnic categories. We saw decreasing test positivities across racial and ethnic categories, both from an overall perspective as well as and when looking at those top 10 zip codes that we have prioritized based upon the disproportionately higher number of cases within those areas. So that's the 30,000-foot summary of where we've seen improvements across racial and ethnic lines, and we'll make sure that once those numbers are finalized, to put those on our county website to make available to the general public.
Okay. And my second question is on nursing homes. We just reported this morning that the state has levied heavy fines of nearly $200,000 or more than $200,000 on 3 nursing homes, all of them in Montgomery County. Has the county been sending inspectors into facilities, or what has the county been doing to make sure there haven't been sort of infection control lapses in the nursing homes inside within the county?
Sure. I think, well, to answer your question, is the state does have the regulatory authority to be able to levy those fines in those processes. And we work very closely with them in terms of completing safety inspections and providing additional support to be able to inform those processes and investigations that they have across the board in general, but particularly if it's complaint driven about a particular facility. And so in terms of the specifics of these investigations within these facilities, the state would have more specific information in terms of what went into the processes to lead to the fines. Now, on a regular basis, we do participate in that process. As you know, we have a nursing home team here as part of our licensing and regulatory services unit within public health services that does routine inspections. And so, for example, during the month of July, they did site inspections of all of the nursing home facilities that are accredited through the state as part of their routine process. Now, also going back to it's late April and early May. It seems so long ago. You remember we implemented Go teams to be able to provide virtual and in some cases in-person support to the nursing homes and assisted living facilities to be able to provide infection control guidance, as well as do some site inspections where even though we weren't able to levy any citations, we were able to provide guidance and background to those facilities. And I believe some of those facilities are a part of the group that you mentioned that have been fined in terms of being able to make sure that they're compliant. And so we continue that process on a routine basis as part of our regular jobs, but certainly during the COVID setting, there has been heightened awareness and increased interaction with those facilities, as well as increased interaction working with the state to provide that information, to inform those investigations, and certainly moving forward now, not now, but especially given that fines have been levied against those particular facilities, there will be even more heightened attention to those facilities to ensure that they are following and abiding by the precautions that have been put into place.
Thank you, Dr. Gales. Don't go anywhere. Caitlin Peets with Bethesda Beat has a question for you.
Hi, good afternoon. I would like to backtrack a little bit and talk about the Bullish situation, just get an update. Once you were notified of that situation and were able to conduct your contact tracing and things like that. Can you just give an update about, what you found? How many more people were advised to quarantine? Were there any more positive tests? And did you provide any other recommendations or guidance to that school moving forward?
So we don't make public all of the parameters of the investigation. We make public, but those are pertinent to the general public. But we did provide guidance to the school in terms of just following up with those individuals who did test positive. We did not, based upon the initial investigation, we did not find any additional positives. There were a number of, I want to say at least 10 to 15 additional individuals who were asked to quarantine outside of those 2 index cases. And it was determined at the time, based upon what we found, that we did not need to identify or deem any other folks as part of the quarantine process. And so the information that we provided to them is consistent with what we would provide to any other business in terms of making sure that folks understand the reporting responsibilities and the requirements that when you are notified, you should immediately contact the health department of known positive cases, as well as to make sure to participate in the contact tracing investigation process. We recognize that different entities have some contact tracing components of their own within their units. However, the rights, responsibilities, and requirements of conducting that investigation lie within the local and the state health department. And so we just reminded them, as well as we remind everybody listening at home, if you are a school or a business and you've been notified of a case, you're required to notify the local health department per state health statutes immediately and as soon as possible, and to make sure to help assist in the contact tracing efforts that are led from the local and state levels. So currently at this time, we have concluded that initial investigation. Certainly if anything else comes from that, we will notify the school certainly, and notify relevant individuals who are affected by that, and notify the public as appropriate, respecting privacy concerns, but as appropriate to get any information out to any other individuals who may need to be updated based upon a potential exposure.
Can I ask just a clarification point real quick? When you said that there were 10 to 15 additional people asked to quarantine, were those staff members at Bullish School?
Yes.
Okay. Thank you.
Thanks, Caitlin. Shen Wu with the Washington Times is joining us, I believe, maybe for the first time, so welcome, with a question for Dr. Gales.
Hi, Dr. Gales. So I just had a couple of clarification questions regarding testing and Avigenics. So are you still all looking for potential COVID-19 suppliers to replace the tests that Avigenics had previously provided? Because my understanding is that you all have extra tests that are provided by the state, and that's what you're getting for a couple of weeks now, correct?
So we continue, so even before any instances that happened with the incident with Avigenics a couple of weeks ago now, we've always constantly been looking to diversify our testing portfolio with a finger on the pulse of emerging technologies and emerging mechanisms and research. So we continue to do that process, and certainly in the setting of what happened recently, we pushed forward even more proactively to bring in other potential laboratories who can help support our testing platform and mechanism, particularly those who are leveraging and utilizing self-collection techniques, because that does allow for us to do more of the high throughput options where we're able to test a higher volume of people in a shorter period of time with less invasive testing mechanisms, particularly for those who are asymptomatic. So that process has continued. We will continue to do that. We will continue to vet and meet with laboratories who may have new technologies or opportunities to be able to support those efforts.
Okay, and now Avigenics came out with an update. So they had said that there was an issue with their temperature stability test with regards to their or study with regards to their tests. And they said that they had to do a pre-analytical temperature stability study, and it demonstrated that no saliva sample was compromised by excessive heat, and they said they need to submit this study to the state investigators in order to pass that inspection that they had previously failed. And so they said that they look forward to a prompt review by CMS and the state so that we can resume the important work of testing during this public health crisis. And somebody had said to me on background last week that just because there was the amended order saying that their license hadn't been actually suspended, was that that could be grounds to possibly affect the termination of the contract with the county. And so I'm just curious, is there a possibility that you all could sign on with them again? And is there a possibility that the termination of the contract could be affected by all of this?
Well, that's an excellent question. I think the first component of your question deals with the investigation and just want to emphasize, we're not a part of that. That's with the state of Maryland and the Centers for Medicare and Medicaid Services. So anything relevant to the investigation process that is being handled by them, we don't have anything to do with that. And so if that is the process, that's an update to their process. Again, CMS and the state of Maryland will have to comment further in terms of how they will use that information and what next steps they will take. As it currently stands, we are awaiting information from the state and CMS to provide further documentation as to what happened and what transpired. And at this time, the only formal official document that we have in place is the cease and desist order that was issued by the state. That you are correct, while it did not suspend the license, it did render the laboratory unable to perform any COVID-related testing, which is the relationship that we had with them.
Okay, and sorry, one last quick question. What is your ultimate testing capacity goal? I mean, do you all have, okay, this is how much we would like to do in the county per day? What's kind of the ultimate goal, the golden number, we should say?
Well, you've highlighted a question that a lot of health jurisdictions are trying to figure out, is what is a magical number. Now, we have utilized a number of resources, as we always do, to inform our different processes. One example is there is a mechanism, a formula that has been put forth by the Harvard School of Public Health that has been able to determine what your mitigation threshold should be and what your suppression threshold should be. And so we've used those formulas to help calculate where we stand. And it's important to note that when we look at those numbers, it's not just looking at what the county provides, it's looking at what the entire testing network, including healthcare providers, clinics, hospitals, urgent care facilities, and other places bring to the table. So we're continuing to refine that information. When we did a first estimate, the volume of testing within Montgomery County exceeded mitigation thresholds and was knocking on the door of suppression thresholds. And I think suppression for us was conducting somewhere nearly about 140,000 tests a month, inclusive of not just only the county apparatus, but also, again, the whole entire healthcare enterprise across the county.
Okay, thank you.
And Brianna with Bethesda Beat also has a question for Dr. Gales.
I'm kind of jumping off of Shen's question regarding Advogenics. So given that if the state gives the green light to Avigenics, will the county consider re-entering a contract with the company? And I know you said the county hasn't received any information from the state. Have you all requested any information or update? And what has been the state's response to that? And what is the county's current weekly testing capacity?
Well, we've requested information, but we also respect the process that this is an investigation that's not led by us. And it's an investigation by the Centers for Medicare and Medicaid Services and the State Office of Healthcare Quality. And we respect their processes and the procedures they have in place to conduct and conclude their investigation. And we will await the results that they make public and share with us and share with anyone else who may have been impacted by the investigation. I think any other decisions will have to remain to be seen in the future. I don't think we can comment any further on that at this point, based upon what information we have. And the current testing capacity, as you know, we've been ramping back up again. I think at our highest peak before we hit some snags, we were testing on our best days somewhere between 1,100 and 1,500 folks a day. And we're hoping to get back to that the last couple of days this week. I think Monday and Tuesday, we averaged about 450 to 500 individuals as a part of the county testing apparatus. Now, moving forward, we hope to go back to where we are testing at multiple sites on a daily basis. That would allow for that number to approach back up to, the 1,100 to 1,500 range on a sustained daily basis.
Dr. Gales, grab some water because Jack Moore with WTOP has 2 questions for you. Jack.
Oh, yes. Real quickly, the town hall with non-public schools this Friday, I believe you said, do you have just a estimate of how many schools have kind of RSVP'd, or how many non-public school administrators you'll be addressing and talking with?
I don't actually have that information. I don't know if Dr. Stoddard has a sense of the volume, because I know his team has been helping to coordinate sending the invitations out and the logistics behind that.
We sent out invitations to 137 schools, I believe, and each school has 3 to 5 representatives on our alert list. And so we're not going to take RSVPs per se. It's open to anyone who wants to, because we allow them to share it with others in our facility, because obviously they have different interests. So my guess is several hundred ultimately will show up, just given what we had last time.
Jack, you had a second question for Dr. Gales?
Yes, Dr. Gales. I was wondering, the CDC recently apparently updated some guidance on testing criteria, and if I was kind of reading it, understanding it correctly, it seemed to kind of really be pulling back on asymptomatic testing of people. And I was just curious if that guidance is going to change and how the county's approaching testing, and if you've had any conversations with the state of Maryland. It seemed like there was actually a push to actually expand asymptomatic testing, given what we know about how the virus transmits. But I just was curious if you had any reaction to this new CDC guidance, and if you had talked to the state at all about it.
Sure. So as we talked about, guidance changes frequently. And so we have to continue to stay on top of it and be able to respond. So as you referenced, there have been some changes in the CDC guidance related to a number of topics within the last 3 to 5 days, including guidance around school reopenings, travel, quarantining, and testing. From our perspective, the public health perspective, we're in a local jurisdiction, or at least I can speak from the health perspective, and I think I would get agreement from the county executive and others on this, is we want to make sure that we expand testing to as many people as possible so that we can identify as many infections as we can, as quickly as we can, so that we can get folks isolated as quickly as we can and remove them from potential networks of future transmission. And we know that there is the evidence of asymptomatic transmission is well documented. And we know that it was the source of a number of cases across the board in community transmission and congregate living situations and places such as nursing homes. So from our perspective, we think it's important to continue to make provisions for those who are asymptomatic, at least in the short term, to be able to test, to be able to identify those infections that otherwise may be missed and otherwise contribute to furthering transmission to other individuals unknowingly.
County Executive Elrich, did you want to add anything to that?
No, I think he said it pretty well.
All right, well, I believe that was our last question of the day. We appreciate all of you joining us. As always, this will be recorded and placed on our Facebook page, and you can find it through Twitter as well. Thanks for joining us this week, and we will see you back here again next Wednesday.
Stay tuned. Thank you.